Good evening, everyone, and welcome to the program Your Health 360. My name is Jacqueline Debija, and it's a beautiful Friday to be with you once again to talk about our health, talk about our bodies. You know, the body is a machine that needs people to check up on it every once in a while. Because wear and tear does happen to the body. And because of that, we must ensure that we know what we're doing, we know what our body is all about. And that is why today we'll be talking about something called neuralgia. I'll let the doctor tell us what neuralgia is. But before then, let me quickly announce that we're actually live on Facebook. So you can actually go on Facebook and drop your comments if you would like. And then we could take them and ask the doctor in real time. If you want to do that, the earlier you can, the better. And of course, you do know that you can send us a text message or a WhatsApp message on the number 09072703270. Once again, that's 09072703270. All right, so let's move to what we're talking about today, called neuralgia. With me in the studio, I have Dr. Godswill Auta, or Auta Godswill. You're welcome to the studio, Dr. Auta.
Thank you so much for having me.
It's great to see you, and for you to be with us. We always like to hear from the horse's mouth. Neuralgia.
Yes.
What is neuralgia?
Okay. To better understand the word, I'll try to break it into two. The word neural there stands for the nerves in the body, and algia is describes discomfort or pain. So it typically translates to nerve pain in the literal sense, and it's characterized by being a burning and stabbing pain one experiences. And fortunately for us, or unfortunately for the person with neuralgia, the body is laced all around with nerve fibers. So wherever the nerve is damaged or injured, the nerve can actually produce, or pain can arise as a result of that. And when it does, we call it neuralgia, and that's nerve pain.
Just so that we're clear, Dr. Auta, what exactly are the nerves? You said our body is laced with them. And for many of us, we've seen pictures of, the human body, human anatomy pictures.
Yes.
And we see red, we see blue, and, some sorts of those ropes that branch out from our main, the artery and the veins. What are nerves? What are nerves?
Okay, well, to understand what nerves are, you have to understand what coordination is. The reason why we're able to do what we do is because we have nerves. Whatever. Take, for example, talking. For you to be able to talk, you need nerves who are responsible for interpreting at the level of the brain, and for your tongue, which we obviously use. We know we use the tongue for talking, and for our lips to move. That synergy, that synchronicity, to achieve that, you need nerves. So nerves are those avenues for conducting the information that is necessary for us to achieve any task whatsoever. So for you, every time you blink your eyes, the information that was received to say, you guys, maybe I'll use an eye blink, the blink of an eye as an example. So for the eye to blink, the brain has to develop the information of the eyes need to blink. See, when someone is bringing a finger near it, okay, so it recognizes that this is a finger coming, the finger is dangerous. That's what nerves do. Nerves are at a particular level, at a higher level. They are trying to do that, to tell the brain to do this. Then it now comes to the muscles that are controlling the eyelid to move, because that's the next thing they have to do in order to protect the individual. So that activity, the instruction to say move together and close the eye, is also carried out by nerves. So nerves actually intertwine into everything we do, and they are widespread in the body. I'll also use another example to make it more, to make it clearer. Whenever somebody has something, say spinal cord injury, and is unable to move the both legs, or that, it's because that transmission of information which the nerves do, that are laced in the spinal cord, they have been disrupted, because they've been disrupted, the ability to move the legs is lost. You understand? So you can look at the person who has um, who has say a spinal cord injury as someone who has been deprived of nerves. So that's how vital and how crucial they are. The
Mm.
same thing happens when someone has a stroke. Something happens in the brain, and then the nerves are affected. The person is unable to speak. So they're intertwined into every activity that we do, and they're responsible for carrying information from one part of the body to the other.
Mm. Okay, so one could say nerves are messengers in the body. They carry.
Yes, you could.
Do they have blood in them?
Um, it would. How would I put this? Yes and no, because they are organized into several layers. They benefit from blood if they are big enough, if they are large enough, then they have their own blood vessels that go to them. Understand? But some are too tiny, so they just tap in from what surrounding area provides. But some are so large enough that they actually have blood vessels running through them to supply them with nutrition.
Mm.
Mm.
Okay. When you were describing what the nerves are, was just in my mind's eye trying to picture the human body, and I know that they're the ones that look like tiny branches all over the body. Is that are they the ones or the veins?
Well, there are actually three that look like that. They are arteries. Those ones carry the blood to the other parts of the body, and they also look like those threads and lines. Then there are veins which collect the blood from the body back to the heart to the lungs. Then there are nerves. They also form a similar pattern. We used to call them. I don't want to use. Okay, we used to call them neurovascular bundles. They go together. The neuro being the nerves, then the vessels being the arteries and the veins. They kind
Mm.
of go together because wherever they are going, they tend to go in a pair of three most
Okay.
times. So if you go to any part of the body whatsoever, you'll see that there's an artery that goes there, there's a vein that goes there, then there's a nerve that goes there. Those on the part of the vessels, the arteries and the veins, they take the nutrition for it to function, while the nerves take the instructions or the sensation, as the case may be,
Okay.
in order to also aid function.
All right. So these things called nerves that are found everywhere in the body that carry messages to and from the brain, operating different parts of us, also come down with conditions, and this in this particular instance, that of pain. How many types of neuralgia or nerve pain do we have?
Um, it depends on how you're trying to categorize them. You could categorize them based on causes. So you could have one that occurs as a result of an infection, and it could also occur as a result of direct pressure on the nerve. It could also occur as a result of a destruction on the like an autoimmune disease that is destroying the body's nerves. You can classify them like that.
Mm.
But commonly, two specific types or three specific types can be described. There is one based on the nerve that okay. Another classification is based on the nerve that is affected. So you say there is a trigeminal neuralgia because the name of the nerve is trigeminal nerve. Then there is an occipital neuralgia because the name um, of the
No.
nerve that is affected is occipital nerve. So you can also classify them in that manner. So a couple of classifications are there, and most of them are either based on the cause or based on the type of the nerve that is affected.
So this trigeminal nerve and occipital nerve, where are they found?
Okay, the trigeminal nerve is actually a funny name, but the tri science tries to make things easy. Tri means three, and Gemini is used for representing twins. And in the body, we have almost everything is duplicated. We have two nostrils, two eyes. So even the trigeminal nerve, there are two of them, and it has three branches. So the tri stands for the three branches. Then the germinal is because they are paired, so they are twins. So it's the nerve that is responsible for sensation on the face. It has three branches that are branched off from the right and the left that help in picking sensation. And most of these neuralgias affect sensory nerves. nerves that are supposed to be responsible for sensation, because they are the ones that are specialized with the ability to detect and transmit to detect and transmit the sensation of pain from the body. So while the occipital nerve is actually the nerve that supplies the posterior part, the just the area above your neck, just below the skull, that area.
At the back.
Yes, at the back of the neck, just a little above it. That's the occipital region. There is a nerve that is responsible for providing sensation to that area. So that's the occipital nerve. So whenever there is a lesion or an injury or damage to the nerve and is exuding those symptoms of stabbing, characteristic episodic pain, we say there is this is likely an occipital neuralgia. If it's affecting the face, commonly the lower jaws and the lower jaws and the lower part of the face, you say it's a trigeminal neuralgia.
The occipital neuralgia, the one
Yes.
that you have just described to us, that is somewhere just a little bit above the base of the neck,
Yes.
and takes, it's responsible for the sensations and everything that we feel at the back of our heads. If one was to come down with nerve pain of that particular nerve, the occipital nerve, what are some of the symptoms that one would most likely come down with?
The first symptom will be pain, that of pain, and the pain will be said to be burning and sharp. And it comes like a stab. It comes and goes, it comes and goes, it comes and goes.
Where? At that,
Yes,
at the
area.
base of the neck.
Yes. Like I said, they are kind of the nerves are paired, and because they are paired, it would depend on which side is affected. But because there's too little transition area, you may feel like it's the entire part of the back of the head. But if it's affected, it's the back of the head. You have somewhat of a headache because it's the area of the head. So you say you have a headache that comes and goes. It's stabbing, it's burning. It may come with some other signs that may not be directly related to the pain, but caused by the pain. Some dizziness, some blurring of vision, because around that area, that's where our vision is actually localized towards the back of the head. So we could have some blurring of vision too as a result of the irritation on the nerve. Some people even come with neck pain, frank neck pain. And
what do you mean by frank neck pain?
Well, rather than having a pain that is above the neck for the occipital neuralgia, someone can just come in with neck pain.
Okay.
So it's a bit lower than we expect it to be, but it's still the neuralgia of the occipital nerve. Yeah.
So the trigeminal then would follow that the pain would be on the face?
Yes, the pain will be on the face. The pain will be.
You would be able. Now, this pain, Dr. Auta,
Yes.
is it going to be palpable? Is it pain that only the patient can feel from the inside, or will the patient on touch feel pain?
Good. That's a good question, because for the case of the trigeminal neuralgia, it has the characteristic of having triggers, such that if you smile a particular way, the patient knows about a particular way that if he even smiles, as little as a smile, he will get the pain. Sometimes a blow of wind towards the area could give him pain, or a tap on the face would actually stimulate the pain to begin. Or even chewing something not necessarily hard, but the fact that he's chewing and the skin around the area where the nerve is responsible for sensation is going to, once the area is stimulated, he can actually have pain. So it can be a pain that can be triggered. And yes, only the patient can actually feel it. When you look at him, you may not actually see any obvious evidence, especially in the trigeminal neuralgia. The type of neuralgia that tends to leave a mark where you can actually tell, okay, there's something wrong going here, is the post-herpetic. It's shingles. We call it shingles. That one, that can leave a mark for you to actually see and so know that, okay, because of the way the skin looks here, this person is likely in pain. But the other ones, the skin may grossly look normal, and the person will experience pain that can be triggered at any point in time.
This trigeminal neuralgia,
Yes.
does it have anything to do with Bell's palsy? Because Bell's palsy, with the face drooping on a certain side, of course, it's also, I guess, nerves, I would
Yes,
think.
it is.
So does it have any correlation? Are they linked?
Okay. Bell's palsy occurs when the nerve involved in Bell's palsy is a nerve that is responsible for movement. So we nerves are classified into two. Some are responsible for movement. Some are responsible for sensation. Some can be have both functions. But primarily in Bell's palsy, the nerve that is affected is the nerve that is responsible for facial expression. There's a nerve that is responsible for facial expression. So we call it the facial nerve. So it's a different type of disease.
Okay.
Bell's palsy and trigeminal neuralgia.
So one does not have anything to do with the other.
They are entirely different. The nerve affected is different. The pattern of presentation. Bell's palsy is painless because the nerve involved is not directly, does not actually have anything to do with sensation. While in trigeminal neuralgia, the nerve affected is actually a pain carrying nerve, and it comes with pain. And often there is no evidence of, though they may coexist. I'll give you an example. For say there is a place where they are nearby, just near the ear here. They come closer. If there is any form of, say, tumor or an irritation that is equally affecting both nerves at the same time, it could actually give you a Bell's palsy and a trigeminal neuralgia. But those combinations don't come often. They tend to exist independent of each other, but they could occur at the same time. In that case, they may be related to the causative disease, but otherwise, Bell's palsy and trigeminal neuralgia are two separate entities.
So you've told us about occipital, you've told us about trigeminal. What about the one you just mentioned now, the post-herpetic, you said?
Yes. Commonly, we know the chickenpox. Okay. Chickenpox comes and it gives you rashes all over your body. It's itchy. Then most of the time, it goes by itself. Sometimes we use some lotions to reduce the itch and improve quality of life. Now, after having an episode of that, there's a tendency that it may recur in people who have, commonly in people who have, say, their immunity is disturbed, say someone who has acquired immunodeficiency from HIV, or someone who just commenced chemotherapy. Chemotherapy has a tendency to reduce the immunity, or for whatsoever reason where the virus gets the courage, we call it, because it's supposed to be dormant afterwards. For whatsoever reason the virus is allowed to proliferate, it can actually come up with what we call a post-herpetic neuralgia. Now, it targets a particular nerve, commonly a nerve around the chest area. It comes with a pattern of pain that is equally sharp, stabbing, and distributes only along the line where the nerve is sending sensory signals to. It may be preceded, or it may just start with pain initially, but sometimes it may come with a rash. And sometimes the person will just come and tell you, I have a rash that is very painful and itchy. So in that case, you see, you now classify it as an infectious neuralgia, and we call it shingles. Yes.
Okay, so this is very interesting, Dr. Auta, because in the beginning, before we got to know quite a lot, or should I say what we know today about HIV/AIDS, one of the things that a lot of people used that time to identify that this person needs to go and check their status is something that in our locality we call wutandere. You would just find like tiny rashes on the person's neck, or usually the upper part of the body, many times the neck, the side of the neck, and the blisters would peel, and it would generally look like someone overnight just poured hot water or something scalding on the skin of the neck, and you would see an ugly, like scaling, like the flesh around that area would obviously look like something burnt it, and it would have some scaling. Is this part of what you're trying to describe, or this is totally different?
That what you just described is another presentation of shingles. Like I said, it comes with a rash, and it can affect any nerve in the body. So the neck is not spared. It can also affect the nerve in the neck. It comes with this pain and just on the distribution, a peculiar distribution. The each nerve has a particular area of the skin or the body where it sends sensation to. So if the nerve in question is sending sensations to the neck, you see that distribution just around the neck, not more than mostly around 1 to 4 centimeters in width, not more than that, just distributed with burning.
Like a belt.
Yes, it's more like a belt. You may even, some don't come with rash, some come with a discoloration, and in very fair people, you actually see that it's red. That was what I was saying. In those people, you can actually know that there's something ongoing here, and it's causing the infection. But not necessarily, it must not be that the person is immunosuppressed before he can develop it. It can equally happen in those who are not immunosuppressed. Though immunosuppression is variable, it could just be a transient moment when the person suffers a particular insult from a particular illness. You may recall when we were younger, we used to have these blisters on our mouth.
Mm-hmm.
They said it's Zazabi.
Yes.
Yeah, so that's kind of what shingles does. Whenever you have a acute insult or a chronic insult on your immunity, it just springs up and gives you that attack on the nerve that is damaged,
Right.
and it springs forth like that.
So apart from the post-herpetic neuralgia, which you said usually is due to someone having, the shingles as an
Yes.
infection, it triggers that. The occipital and trigeminal, what triggers them? Could it be a slap? What trigger, or it just happens?
Okay, for the trigeminal neuralgia and the occipital neuralgia, a number of things can cause it. It could be a direct damage to the nerve. Sometimes tumors will grow. Tumors are abnormal growth in the body. A tumor may grow around the area of the nerve where the nerve is passing through, and irritate the nerve to the extent that the nerve becomes damaged. Or as someone ages, there are some degenerative changes that occur to the bones. The bones may grow abnormally to compress on the nerve. And another thing that may happen is the blood vessels. Remember I said the nerves tend to travel with some blood vessels together, like in a triad.
Mm-hmm.
So sometimes the blood vessels may grow to an abnormally large size to the extent that they are irritating the trigeminal or the occipital nerve. In those, especially the occipital nerve, it's more likely that a blood vessel or the bone in the neck is actually growing some spores around it, and it's irritating the nerve. So once the nerve is irritated and it gets damaged, those type of abnormal sensations start to occur. So those are some of the common causes of the of those type of neuralgias.
In the case of post-herpetic, is it only shingles, or something else could also trigger it?
The word shingles is used to describe the disease, but the main causative organism is the same virus that causes the chickenpox. We don't really we control the virus. Our body has the ability to control the virus, but during the time where our immunity is suppressed, the virus kind of comes out and looks and say, "Oh, the guy that was looking at the doors is no more there." So it comes out, and most of the time, it normally stays in around nerve endings, and it comes out and it shows up for itself. So it's the virus that causes chickenpox. When immunity is suppressed, it causes a disease called shingles, which is what we call the post-herpetic neuralgia. So it's a viral infection.
Right. So is it just the virus that causes the chicken pox, or this one that causes for us to have blisters when we say we have fever blister or zazzabi, like you said.
Yes.
Is that also something that could add these in the same group? And then, of course, the one that can be caught sexually, the herpes virus.
Yes.
Are all of this in the same group? Could they lead to shingles, or is it just particularly the one that causes smallpox?
Okay. The herpes viruses are numerous. There is one, there is herpes 2, there is herpes simplex 1, herpes simplex 2, then there is herpes varicella virus, which is the one that is responsible for causing chickenpox. For the blisters we have in the mouth, it's commonly caused by herpes simplex virus 1. It could equally be caused by herpes simplex virus 2. But herpes simplex virus 2 is the common one we have. It's a common one that it causes the sexual blisters, the sexually transmitted blisters. So there are different categories of viruses, but from the same family. So to say, they affect different parts of the body, and they have a different pattern of inheritance. The herpes simplex virus, almost nearly 90% of people have it, the virus 1. While the herpes simplex,
that's the one that causes what we call
blisters,
zazzabi.
yes,
Right.
zazzabi. The simplex virus 2 is the one that is responsible for blisters around the genital area, which occurs as a result of sexual exposure to someone who already has the
virus.
The virus. But with the advent of oral sex and all that, so you can have the simplex 2 causing blisters in the mouth in individuals. So it's the same family, but a different class of the virus.
Okay.
I don't want to say elder brother and junior brother, but they're from the same family of viruses.
Okay, but only that one particularly that causes smallpox, where that's the one, chickenpox.
Yes,
sorry,
that's
the one that could actually cause shingles.
Yes, that's the one that is the commonest culprit in causation of shingles.
All right.
Yeah.
Let's quickly go on a commercial break. If you're just joining us this evening, we've been talking about nerve pain, otherwise known as neuralgia. Seems quite interesting. There are quite a number of things that we're just learning today, and hopefully we'll be learning more after this break. Do stay with us. Your Health 360, only on Invicta 98.9 FM. Well, thank you for staying with us through that commercial break there. Still with Dr. Godswill Auta James in the studio. And we've been talking about neuralgia, also known as nerve pain. Now, before we went on that break, he had told us about occipital, he'd talked about trigeminal, and what was that last one again? The shingles, the post-herpetic or something like that. Yes. And my next question, quickly, before I open up the phone lines, would be, what other... We have back pain, chronic people who suffer from back pain. A lot of people, there are names for it, of course, spondylosis. There's one at the groin, just where the pant line is. Many times people suffer pain in those areas. Just wanting to ask, are those also nerve pains, or is there something else going on?
Okay. For a disease like, say, back pain is broad term. A lot of things can cause it, but there is a constituent of back pain that can be attributed to nerves. Like, say, in an individual who has what you call lumbar spondylosis, there is, remember I mentioned about some bones that grow abnormally and they may compress on nerves that pass near them. That's what happens in lumbar spondylosis. It comes with aging. And because our body undergoes wear and tear, sometimes the wear and tear the repair for the wear and tear is not as good as it should be. So we have bones growing abnormally, and all the nerves that we carry in our body, they come from the back. They're in the spinal cord, and they have to go to reach even the toe. As they're leaving the spinal cord and those bones are forming abnormally, they may compress on the nerve. And once they compress on the nerve, it can cause some nerve damage. And that could give the pain that individuals have in the back. And often you hear them say that they have a pain in the back and they feel it in the leg. I remember we said that for neuralgia, the pain tends to go everywhere the nerve goes. So that's what happens. See, you have a pain in the back, you now start feeling it at the back of your leg because the nerve actually goes there. So it's disturbed. You call it radiculopathy in that situation, but it's also a form of nerve injury that and the pain can actually be it's actually constituted majorly because of the damage to the nerve, but the presentation is rather different because how it expresses the pain is not like when it comes to the skin. It causes the muscles to contract heavily because they are irritated, they are damaged and they are irritated, and they kind of contract strongly and give you that dull, crampy pain rather than the sharp, stabbing pain we used to experience in individuals who have frank neuralgia. So yes, there's some component of nerve damage, but it's not as isolated as in individuals who have pure neuralgia.
Doc, this radiculopathy that
Yeah.
you just called, is it the same as what you people call is this sciatica?
Sciatica, yes, it is. It is. It's because the nerve that is involved is the sciatic nerve. So if you have that kind
Okay.
of radiculopathy, it's so they can actually be used interchangeably. Radiculopathy would just mean that the pain is traveling along the course of the nerve, while the sciatica would mean that the particular nerve that is involved in this situation is the sciatic nerve. So they could be used interchangeably, but one is more specific and the other is.
Finally, how do you differentiate between muscular and nerve pain, neural pain? How do you know which one?
Okay, well, sometimes it may be difficult to distinguish, but the common thing to find out is the story the patient will tell you. For nerve pain, the character of the pain is that it's sharp, it's stabbing, it can equally be described as burning. Some may even say it's almost like an electric shock going through the body. So that tells you that this is likely a nerve pain.
Okay.
While muscle pain, the best I can actually bring to describe it is crampy. It's a crampy pain. It's just like a tightness, a band, and so it can be severe, but it's rather crampy rather than sharp. It's more crampy rather than sharp. Sorry. So from that, it may help you to, and then the location of the pain. You will not see, for example, where there are a lot of muscles. You will not be and then there are few there's few nerves that are supplying the skin. You may not be able to say, okay, this pain is likely from the nerve rather than from the muscle when it's predominantly a muscular area. So the location of the pain will also help you to say, okay, likely this is where the pain is coming from, rather than it's rather muscular than um, nervous.
Okay.
Yeah.
So we're having the lines open right now. You want to ask your question, still looking out for your text messages. Don't have any just yet. You might want to call in at this time to speak with Dr. Atta. And the numbers are 081 40,000 989 and 07087800989. Once again, that's 081 40,000 989 and 07087800989. While we wait for those calls to come in, Dr. Ota, I would like, okay, we have a call already. Let's go take this call. Good evening. Good evening. Good evening. Please stay away from your radio set. You're too close. You're too close. Switch off your radio.
I'm not near any radio. There's already in the room. I am inside.
Are you listening from your... There's feedback. Serious. Okay, go ahead.
Okay, the name is Mala Abdul from CRP in Boston.
Okay, sir.
Now, he's talking about now. I don't glaucoma I learned is related to the nerve. Does it cause much pain and reversible, irreversible, or does it have any pain? You are talking about now, generally, and I think glaucoma, I'm talking from it, but I want to have more knowledge about how it's related to nerve.
Okay. Well, thank you very much. I think maybe you were listening. You were using your handset. The handset was the radio. I think I don't know. Anyway, but I think what he was asking, he wants to know more about this. Is it reversible? Can you reverse nerve damage, or is it irreversible? Still taking your calls this evening. Okay, I think this problem must be with us.
Hello?
Hello. Good evening.
Good evening, ma.
Go ahead.
Yes, ma. Please, my daughter always have blisters in her mouth. What is the cause of that? Always blisters in her mouth. I
Okay.
don't know. What will I do?
All right. Dr. Ota will answer you. All right. Still taking your calls this evening. Apologies. I think there must be some crossed wires because that couldn't have happened to two consecutive calls from different places. I don't know what's going on, but let's manage it this way while the engineers are working on it. Hello. Good evening. Hello. Okay. Doc, you want to quickly answer that question?
Yes, I'd love to answer.
Go
To the
ahead.
question as to whether nerve pain is reversible, it depends on the cause. There is another one that I'll use diabetes as an example. Diabetes also causes nerve pain, and because of the high level of glucose in a diabetic's body, it goes into the nerve itself and actively destroys the nerve. But if you're able to because the destruction is not actually very depending on the level where you meet it, if you're able to control the sugar of the patient, those symptoms have the tendency of reversing. So yes, it's possible to reverse the damage if the insult is removed on time. Other times it may be an irreversible insult, say traumatic say you traumatize the nerve. It may give the pain, but the pain may not really be reversible per se. So in some instances, we go as far as, since most of the nerves that are affected are sensory nerve, we go as far as removing the connection of the nerve to the other system of nerves so that it stops transmitting those nauseous sensations because of how destroyed the nerve is. So in some instances, yes, it is possible, and some types of neuralgias may be caused by, say, there's one in multiple sclerosis. It is an autoimmune disorder. In that case, the nerve destruction is ongoing and it cannot be reversed. So in that instance, the nerve pain may not be reversible. So it depends on the cause. I'll use another example. Lastly, if, for example, if it's like the trigeminal neuralgia, commonly a swollen blood vessel is the cause. If the swelling is can be handled or the pressure can be relieved by whatsoever means, by you can actually remove the pain can actually be stopped. And because most of the nerves are sensory nerves, once you treat the pain, you tend to solve the patient's problem. Yes.
Okay, so let's quickly go back to taking a few more calls. Hello, good evening.
Hello, good evening, sir.
You're welcome, sir. Go ahead. Your name?
It's Moses, calling from Parnell.
Go ahead.
Yeah. Good evening. I met the program. I didn't start with you, but I met the part where the doctor was explaining about virus.
Yes, go ahead.
He was talking
We're
about
talking
virus.
about nerve pain, the kind of things that could cause nerve pain for us.
Yeah, the part I think was he was talking actually about virus that cause chicken pox during sex or something.
Mm-hmm.
That's the part because I am experiencing something like that.
You're having blisters around the genital area?
Yeah, anytime I had sex with my wife, after a day, I will start having something around my genital area.
Okay.
Yeah, so it's irritating and it's even making me run away from
It's painful.
Taking
It's
her
itchy.
medication.
Does it go away on its own?
When sometimes I apply this Damatol and take this tablet.
Please don't call the name because we know how to abuse drugs. I don't know. Was it recommended for you, those drugs?
No, 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 no.
You on your own
It was
decided to use
recommended
them?
for. I use it for treatment of ringworm of my son sometimes. So that was I just when I take it, it will go down. But anytime I go again, it comes back.
Okay. All right. Dr. Ota will answer you. Thank you for calling.
Okay.
Thank you so much for sharing.
All right. Thank you. God bless you.
Thank you. Amen. Thank you. You too. All right. Still taking your calls this evening. I think we can still squeeze in a few more calls before we come back to Dr. Ota in the studio. Still taking your calls this evening on the topic neuralgia or nerve pain. Good evening.
Good evening, ma.
You're welcome. Go ahead, sir.
Thank you very much. I am Abraham from Wuhuta.
You're welcome, sir. Go ahead.
Thank you very much. I'm so happy with this program.
Thank you.
Concerning this nerve pain, does it affect area of a stroke? I would like to have an idea.
Your question again, sir. You said, is it?
Stroke.
Okay, stroke. Okay.
Yes.
Okay.
Does it affect and bring stroke to somebody?
Can it cause stroke?
Stroke.
Yes, you're asking if nerve pain can cause stroke.
Stroke. That's right.
Okay.
That's right.
All right, sir.
I'm having a partial stroke.
Okay. All right.
I don't know.
Is there any
And
question?
I have the symptoms of this pain, and also my back here is also paining me,
Your
and my
back?
legs also. Yes, the back.
The upper or lower back?
The lower one.
Okay. Okay.
Yes.
All right. Okay, sir. Thank you for sharing.
And
Okay.
the legs are paining me also. And I find it difficult to walk. Yeah, I don't know.
Okay.
Because hence we deal with cells
Okay. Okay.
and nerves.
All right. Okay,
Thank
sir.
you.
Thank you for calling and thank you for sharing. Still taking your calls this evening. But while we're waiting for other calls to come in, I think you can go ahead and answer the calls, the questions we've had so far, Dr. Ota.
Yes, thank you for your questions and for calling. A question about her daughter having constant blisters in the mouth. What can be done? It's not really normal if it's just one occasion, but if it's repeating itself, it tells you that there is something that is going on. When something happens today, it happens tomorrow. What it's telling you is you need to be evaluated. So whatsoever you're facing is unlikely something you're going to have a solution to by testing. I'm sure you must have tested a lot of therapies, vitamins, etc. But it's not going to go away until we're able to establish why she's having it, and that's something that can be better sorted in a hospital setting. So my advice to you is don't take it as just blisters. I can tell you're a bit concerned about it. The best way to address it is to visit the hospital where you can be able to have it evaluated. It's unlikely in neuralgia because of what you described, and I would my advice to you is have it checked out in your hospital. And also whether nerve pain can cause stroke. Nerve pain cannot cause stroke. The causes of stroke are different, and stroke happens in the brain, while nerve pain happens outside of the brain. Most nerve pains are attached to the areas of the skin. Most commonly, the skin is affected.
Okay, we don't have them in the brain.
No, the nerves in the brain don't. They're not sensations.
Okay.
They're more like they are the ones that think. Different nerves have different functions. Sorry, I didn't mention that. So the nerves in the brain are not responsible for sensation. The nerves around the body near the skin are the ones that are responsible for that. So it's unlikely that enough pain can actually have cause a stroke. most commonly hypertension, diabetes, dyslipidemias, abnormal cholesterol levels, some lifestyle, smoking. So those are the things that can actually cause a stroke, and though some of them can actually cause nerve pain, but that nerve pain causing stroke is unlikely, and it doesn't happen.
So, but why does he have pain in his legs or
Yes.
feet? He said.
Yes, from what he's describing, I'm sure he's around is about a Middle East man. So he, like I said, there are some changes that can happen in terms of degeneration of the body, which could actually cause him to have pain. However, there are other causes. We're focusing on one topic. It's not one thing that can cause the symptom. The causes of back pain in an adult male can be 100, and in an adult female there can be 100 different reasons. So each and the thing about symptoms is it's not the symptom you're treating. You have to treat the person with the symptom, because he may volunteer the fact that he's also having back pain, but there are other things that you cannot be able to assess from just the fact that he has back pain. Yes, so it could be a degenerative spine disease, but it could be something else. For him, also, I would recommend he sees a doctor, preferably an orthopedic doctor, who would evaluate him for why he's having the back pain. Often, what we tend to miss is we try to want to treat what we're having. We don't want to know what we're having. So, if we're able to know what we're having, which is what happens in hospitals, we're likely going to have better control as to the disease itself. And so, yes, nerve pain and stroke, the two different disease entities.
Okay, so what about the man who has blisters all the time after meeting with his wife?
Yeah, so the description, unfortunately we can't get detailed history from him, but that it occurs frequently. Like I said, if it's once or twice, it could be incidental, but once it's a repeated occurrence, it's something to evaluate. I feel he may be having a sexually transmitted infection, or he could actually be having something different. So many things can occur that can cause. That's the emphasis I'm trying to drive, is that you're having blisters especially over the penis, is unlikely a neuralgia. Most likely sexually transmitted disease, but it could be something else. So it's something that could be evaluated also to find out the cause. It may just be a 15 minutes discussion and interaction, and the pattern of the blistering can actually may actually help in telling what the disease is. And I noticed I think there was confusion. The virus that is responsible for causing shingles, the type of neuralgia, is not sexually transmitted. It's the simple, not really simple per se for the person that's suffering the virus. It's the virus that causes chickenpox, which we get from close contacts and with individuals who have an active disease. So the one that is transmitted by sexual intercourse is the herpes simplex virus type 2. It's the common one that is responsible for causing those blisters in the genital area.
Do we still have smallpox? Or is it chickenpox? Sorry.
Chickenpox.
Yes,
we still have.
I know we've eradicated smallpox worldwide.
Yes.
But what about chickenpox?
Yes, it's widely. It happens widely. We have it a lot. We have a lot of it. Some countries have actually reduced the incidence, but I don't think there's a country that can boast of not having it. In the UK, I know since the 1970s, they've been having a vaccination program against developing the varicella virus. So, yes, though there are, because what we try to do in eradication is to target diseases that are that have a significant burden of disformity or mortality. And chickenpox have not risen to that level. So, we've not eradicated it.
Well, here's hoping, because I mean, with the shingles and everything you just described, it gives real reason for people to at least take your kids to get vaccinated. I'm sure you heard Dr. Atta. I think the most important message this evening, and has always been on Invicta's Your Health 360, is that we get evaluated. The earlier, the better. For those blisters around your genitals, please stop treating yourself and go see a doctor. There's no shame in that. It's better to err on the side of caution. It might just be irritation. Maybe you use condoms or something, I don't know, but it's better you go to a doctor. Let the doctor tell you what is going on so that you can treat yourself and treat your spouse. It's very important. Dr. Auta, would like to thank you so much for being here this evening.
Thank you so
It was
much
a joy.
for
The
having
time just went by so fast. Well, here is hoping that we learned a thing or two this evening. Until next Friday, when we hope to come your way again, let your health, knowing about it, be paramount. And please let us not be afraid to see doctors. I know that the times are difficult. You think about the money, but think about what would happen if we refuse to go see a doctor and this condition grows worse. And then finally, when we go to see the doctor, we hear, oh, if only you had come earlier than now. So please, let's go to our general hospitals from Barao Diko to Yusuf Dansoho to Gwamna Awan. They're around us. Please just go there, get your card, and see a doctor. And yes, last week I promised that I would go to the neuropsychiatric hospital. I did. Unfortunately, I could not post any videos because I suddenly realized that there was the matter of privacy for the patients who were there. And before I could take any videos, there had to be a long process to get permission. But I did go, and I will tell you that it is as simple as ABC. So if you need to go to the neuropsychiatric hospital for whatever reason, walk in there. There are a lot of people like you and I that are accessing treatment already. Until next week, remain healthy and victorious.